organizing the public health boiler, there is a lot of planning process that goes into it. The first process is the community awareness. Community should know about their health entitlements. The second process is to organize the community forums. Like in health sector, we have got VHSNC, Village Health Sanitation and Nutrition Committee. We have got Jan Arogya Samiti. We have got Rogi Kalyan Samitis. So all these, committees or public forums have to be empowered. The third part is like if they are empowered, then a community inquiry has to go into it. Now this community inquiry is being taken up by the public itself. Once they do this inquiry, they come out with the denials. Denials means the issues which are affecting their health. So it is being compiled and finally it is to be presented to the government. Now, in the government, we have got different kind of line departments. Say, for example, the health department is there, then there is other departments like WCD, Women and Child Development Department, and then the IPH department, then we have got Rural Development Department, ERI department. So all these line department also directly or indirectly affects the health of a person. So everybody sits in front of the public and they try to address all those issues which are being faced by the public. And the whole process of these 6 steps, the community awareness, the formation of the public health forums, and then their empowerment, and then the community inquiry, and the compilation of different issues which the public is facing. All these whole exercises requires a lot of planning, and then all these issues are being addressed in the public dialogue. Breastfeeding promotion is a very noble cause. You see, in Indian context or in world context also, the mother's milk is like an amrit to any infant. This milk, infant milk producing companies, they deceive all this concept and they just want to sell their product. So there is a different kind of an campaign from them. So this whole process in which we were being involved, we just wanted to make aware about this fact to the public that breast milk is the best milk for any infant. So this is today's youth are not the youths of our time. They are facing a lot of pressure, the career pressure, the expectations of their parents, and then the peer pressure, then the college pressure, and then there are this mobile pressure. So all these pressures create a lot of mental health issues with them. And now these mental health issues take them to sometimes to the drugs, to the issues of HIV, to the issues of different kind of nutritional problems, and then violence and the right use of mobile. I personally feel through our personal forum called SOHAMINDIA.org, we are channelizing the energy of the youth through the mindfulness. I personally feel that if all the youth of today, somehow involve themselves into the practices of mindfulness, they would deplete all these pressures which they are facing. I also feel like we also need to have counselors regarding the mental health issues which they can approach to. For me, these are the main 2 ways to mitigate all these pressures which the youth is facing today. See, today's world is having a lot of pressures, and this pressures is creating non-communicable disease. Everybody, every second person, you must be knowing that they are facing the problem of hypertension. They are facing the problem of blood sugar. They are facing the issues of cancer. Now, different kind of these non-communicable diseases are the challenges of community of today. I personally feel like different kind of community forums like we have at the village level, the village health sanitation and nutrition committee. We have the Jan Arogya Samitis. We have Rogi Kalyan Samiti. These are the forums at the community level which can create a kind of an awareness about the hypertension issues, the weight loss issues, the nutritional issues, the right eating kind of an issues. So all these public forums can create an awareness, and then There are different kind of an approaches, like people are creating marathons, people are creating the campaigns for right kind of an eating. These would be the kind of an issues which are important and which are being taken care of.